Hey everyone, let's talk about carcinoma of the gallbladder. So, this is the most common malignancy of extrahepatic biliary tract. It is slightly more common in women than men, and it occurs most frequently in the seventh decade of the life. So, what all you have to remember, this is the most common malignancy of extrahepatic biliary tract. It is more common in women than in males, and it occurs in seventh decade. Approximately 5,000 cases are diagnosed annually in the United States, and this is very important thing. It is very rarely discovered at a resectable stage, and that is why the mean 5-year survival rate has remained unchanged at about 5 to 12% over many years. So, what are the risk factors for gallbladder cancer? First one is the gallstones, which are almost present in 95% of cases of gallbladder carcinoma, and thus they are the most important risk factor associated with this tumor. Okay, so why gallstones are causing cancer? This is because of chronic inflammation, which is a known enabler of malignancy in several organs. Next up is the carcinogenic derivatives of bile acids, which are also suspected to play a role in the malignancy. And third one is the primary sclerosing cholangitis, which may predispose to the occurrence of the gallbladder cancer. So these three are the risk factors. First one and the most important one are the gallstones. Second one is the carcinogenic derivative of bile acids, and third one is the primary sclerosing cholangitis, which predisposes to the occurrence of gallbladder cancer. So these are the risk factor and epidemiology. If we talk about the morphology, so it grows in two patterns of growth. First one is the infiltrating, and second one is the exophytic. As the name also suggests, infiltrating pattern, it is more common and usually appears as a poorly defined area of diffuse wall thickening and induration. So the wall of the gallbladder will be thickened in case of infiltrating, and there will be induration, whereas in exophytic pattern this growth will be into the lumen as irregular exophytic mass, thus at the same time invades the underlying wall. Most carcinomas of the gallbladder are adenocarcinomas. About 5% are squamous cell carcinomas or have adenosquamous differentiation. So we have the infiltrating, and in case of exophyting, even also involving the wall, but there will be a exophytic growth which will be present in the lumen. So as we can see over here, we have the gallbladder and we have a exophytic mass in the gallbladder lumen. In the photomicrograph we can see that there is glandular differentiation, gland formation are there, and which is the characteristic of adenocarcinoma, and there are inflammatory cells also. So this will be the microscopy. If we talk about clinical features of gallbladder carcinoma, it will be very much similar to the gallstones, very non-specific, like pain, anorexia, loss of appetite, and weight loss, all those things. That is why the patient will not present and will not be suspected till later stages, and that's why the prognosis is so poor. Okay, so this was all about gallbladder carcinoma. Thank you so much.